All right? And so now while we're in this position, we're going to jump over to the knee. Okay, this is the one that I mentioned. It's not in the book, but if you want another way to do meniscus test, and you can do McMurray's, but here's another one that's easy. Is you press down like this and you grind like that. Because what's the mechanism of injury of meniscus? Axial load and grinding. So if there's pain with that, it's indicating meniscus problem. Now if I do this, and then normally the way you do it is you put your leg up here and pull up like that. Okay. If it's if it's a large patient, you may have to do that. In this case, I think I can do it okay like this. I mean, I can even go like this. So what tissues am I affecting when I do this? Right. So if I go like this, that's going to be more likely to indicate maybe a ligament issue rather than this is a meniscus issue. Okay.
That's Apley's.
Yeah, Apley's compression and distraction. The Bellenberg's. Okay. I think we practiced that one enough, right? Which side is going to drop when I do this? Yeah, the right side or the non-weight bearing side. Valsalva, and that one. And then just keep in mind if I say do a test for increased intrathecal pressure, that's what that's going to be, Valsalva. So it could be a disc herniation, either in the cervical or lumbar, it could be a spinal tumor, anything that's putting pressure on the spinal cord or the nerve roots. Sitting root test. I don't need to demonstrate that. You're sitting. Everybody can do that on themselves. Right? On the knee like that. Okay, so that's a nerve traction thing, right? Anything that's like a straight leg raise. Okay, so if you're doing that, what's another thing you can do to step that up a little bit? So you're stretching at this end. What's that? Yeah. Dorsiflex flex foot and then the head. What's on the other end of the nerve? This side. Okay, so straight leg raise. So somebody else was saying maybe we should call this the single straight leg raise. And then there's the double straight leg raise. But in this case, basically you're just raising the leg up. And at what point do you expect to start seeing the pain if it's a nerve root? Or what degree range? These are from about 30 to about 60, maybe 70 degrees. And when you're doing this test and you write down in your notes, you're going to want to make a notation that says, okay, pain at this amount of degrees. And then what else do you want to know? Yeah, but also location of the pain. Where is it? Is it just in the low back? And then the other thing as far as their quality is like, they say, well, yeah, it's kind of tight back here. So that could just mean tight hamstring. And then what happens if they have pain down the legs on the table? That's a well leg raise test. That could be more of the medial disc herniation, or more of the lateral. So again, you want to happen at the from about, it starts at about 35 degrees, goes up to 60 degrees. If the other things are all the way there, you've already gone past the point of the nerve traction. And then performance test. Let's see. This slide was moved. So you need to have the knee over the edge like this. Okay, then there's different ways you can stabilize it. What I was showing before is you can do it on the sacrum. I think another way is here if you hold the pelvis. Right, you're still kind of locking it out there. That might be easier. So you can put that in as another option. And then in this case, the actual performance is going to be external rotation, right? It's pulling here. So I want you to press in your hand this way. Yeah, there you go. Okay, so and then I can stabilize the knee here. So press down this way into my hand. Okay, so now contract muscle, so that might bring out the condition of the nerve more. So you could have in this area here, they could tight performance muscle, or it produce pain down the leg, or wherever there. What does that reach the symptoms that you have? And then the full nerve tracking test. Yeah. Okay, so first you do is you kind of put some slack in the nerve, you flex the hip and the knee. Then you extend the knee, extend the hip, and then now's when you're torquing it here, you flex the knee to look for the symptoms on the front of the leg, front of the thigh, I should say. If it happens if you get symptoms on the other side, cross femoral nerve traction test. If they get something going on here in the low back or the SI, it could have a disc herniation, it could have a SI problem. So you want to differentiate just where's the pain at. Okay, so let's do another. Okay, so then let's go over those. The actual hip joint proper, we did the Faber's test already, right? So on page 138. And then Stitchfield, you're actually doing the resistance of the muscle contraction test, but you're still assessing the hip joint. So I'm just going to raise the hip up like this at 30 degrees. Don't let me move down. Press into my hand here. Press up here. Okay? So you're looking for, it's not so much weakness, it's not really a muscle test, but you're just looking for pain in the hip. Or they could, again, if they have pain on the back, there could be something going on with the SI joint, lumbar spine, something like that. But if it's pain, in the hip joint proper, then more significant of a hip joint problem. All right, now slide down to this end so that your knee is at the edge, so that your lower leg's hanging over. Okay, now this, we already kind of saw that there was maybe a little bit something going on with the hip flexor contracture. Okay, so based on what you see here, what do you think is more likely? Is it in the hip or in the rectus femoris? Right. Because see, as I do this, it's pulling the rectus femoris. The hip flexor contracture would be like this. You get to the point where, once you take out the slack, you get to the point where it correlates directly. As soon as I move this, it's either going to move there or it's going to move here. So there. All right, now I want to know, is this really shortened or is it just pulling up because of the tension? So see, she's got some more slack in it. So it's not really a big issue. Okay, so that's the hip flexor contracture, or the Thomas test, and then rectus femoris contracture. Okay. So basically it's the same kind of test. If it comes up here, it's the hip flexor contracture problem. If it's coming up here, it's rectus femoris. And then the other one is Ober's, which you slide up this way, lay on your side facing that way. Now in this case, this leg can be straight like this, or the knee can be bent. You're bringing it up like this, and then let the leg drop down. Okay? So you're looking for like real tightness in here. It's coming down like that. Okay? So you can try it in both positions. Let's see. Okay? So that's it for the hip.